Hi, I'm Tabitha Butcher, and this is my health promotion presentation on chronic kidney disease. So the definition and etiology. Chronic kidney disease is kidney failure, which is diagnosed as acute kidney injury or chronic kidney disease. Without aggressive treatment or when complicating pre-existing conditions exist, acute kidney injury can result in chronic kidney disease. This is also abbreviated, you'll often see as CKD. So CKD is a progressive and irreversible kidney disease. Once you get past that point of it just being acute, then it is no longer irreversible. There are ways to manage this disease, though, to make the patient's lifespan go on further. So a client who has CKD can be free of manifestations except during periods of stress, which would include infection, surgery, any sort of trauma, just stress on the body. As kidney dysfunction progresses, manifestations then become apparent. So oftentimes at first, the early stages of CKD, the patient may present with no signs or symptoms. Adults are at an increased risk for CKD related to the aging process. So a decreased number of functioning nephrons, which would be the GFR, which is the glomerular filtration rate. Next, we'll look at the pathophysiology. So it is thought to be caused by prolonged acute inflammation that is not organ specific and thus a subtle systemic manifestations. So what that means is, again, in the early stages of CKD, you're often not going to see any signs or symptoms, and currently it is not 100% clear on the causes of chronic kidney disease. It is still in early stages of research, and they just don't have a direct link to the cause right now. Clinical manifestations. So there are 5 stages to chronic kidney disease. The first that we will look at has minimal kidney damage when the GFR is within the expected reference range. So this is greater than 90 milliliters per minute. Stage 2 is mild kidney damage, and that is just, again, a mild decrease in the GFR, which on here you can see the ranges for each of these that are expected. Stage 3 is moderate kidney damage with moderate decrease in the GFR. Stage 4, severe kidney damage with severe decrease in the GFR. So you can see we're going from ranges of 90 down to between being 15 to 29. And then stage 5 is kidney failure, or what they call end-stage renal disease. And this is with little or no glomerular filtration rate. Some other manifestations that you might see include nausea, fatigue, being lethargic, some depression, involuntary leg movements are common. Intractable hiccups, not as common, but it is a complaint that some patients come in with. In most cases, findings of chronic kidney disease are related to fluid volume overload, because CKD causes a lot of electrolyte imbalances, which you'll see when we get to diagnostics and tests. A lot of the labs that you assess for are related to those electrolyte imbalances that you're checking with the patient. That's one of the most common signs that you're going to see initially. So the diagnostics and testing, which again, the labs, what we're going to see here is doing a urinalysis. So you're going to be looking at things like hematuria, proteinuria, a decrease in specific gravity. You're also going to be looking at the blood creatinine, which is a gradual increase over months to years with CKD. and it can increase over those months. The BUN, we're looking for a gradual increase with elevated blood creatinine, and that again can be over months to years. So the thing with these labs, you have to be very vigilant and look at the trends, because this can happen very slowly actually, and is why it's missed a lot of times until it is really progressed. We're also looking again at the blood electrolytes, so we're looking for a decreased sodium and calcium, increased potassium, phosphorus, and magnesium levels. CBC, we're looking at a decreased hemoglobin and hematocrit from anemia, because a lot of these patients are anemic, secondary to the loss of erythroepitin and CKD. Some diagnostics we're going to look at that is typically done as a cystoscopy, retrograde pylography, and a kidney biopsy. Imaging that is typically done with these patients would include an ultrasound, the kidneys, ureter, and bladder, which is you'll usually see in the hospital as a KUB, a CT, MRI without contrast, and an aortorenal angiography. Some common complications of chronic kidney disease. Again, the number one thing that you're going to see and hear complaints about is with the electrolyte imbalance, and just, things like nausea, fatigue, being very lethargic. You'll hear a lot out of patients. So that's when we're checking those labs. We're going to look at things like dysrhythmias, so we're going to want to do EKGs on those patients when they come in and check to see what their heart rhythms are looking like. Fluid overload, again, symptoms just of fluid overload. Hypertension, metabolic acidosis, any secondary infections. It's common with CKD for patients to have something else going on. So if they do come in with complaints of other infections and they might have some other signs and symptoms, be sure you're just paying close attention to those labs, because it could be a precursor to CKD. And then uremia. The NLN competency that I focused on with this project was human flourishing, just because I think it is really important with these patients to have some independence, a lot of times because there are a lot of things that go on once the patient gets into later stages of chronic kidney disease. And that's because they go through some pretty hefty treatments. Again, this is an irreversible disease, so you often look at them having to go through what's called dialysis, which there's regular dialysis, hemodialysis, and then peritoneal dialysis. So depending on what the patient is going through, it can be really confusing for these patients on top of the added stress. And again, we're wanting to try and create the least amount of stress as possible for these patients, because that's when their symptoms can become a lot worse because of the stress on the body. So the different types of I wouldn't say treatments because it's irreversible, but just things to prolong their lifespan takes a heavy toll on them. So with the human flourishing, we want to promote their dignity, integrity, self-determination so they can remain independent, and personal growth as each patient as an individual. Again, even though we don't know a whole lot about chronic kidney disease, it's not just every patient experiences the same things. So we want to be sure that we're treating each patient on an individual basis and individualize their care. Also, we want to provide culturally appropriate and relationship-centered care. So just like any other condition, we want to make sure that these people are treated with respect. We want to be able to understand their boundaries. So when we go in and do procedures and things with them, just make sure we're asking them about their diet, because different religions, ethnicities, cultures, they have different diets that they abide by. So whenever we as nurses are working on that renal diet, we want to take everything about the patient into consideration. And then here are my references, which what I used was the Brunner and Stoddard, the Hinkle and Cheever book, and then of course API. And then I have also prepared a quiz for this. So the link is available on here if anybody wants to go through. There's just 5 questions on here, but I tried to get some that make you think on the spot about chronic kidney disease. So we will go to that. So the first question, true or false? Chronic kidney disease is a completely curable disease. From the presentation, we know, unfortunately, that is not true. So we are going to put false. And again, that is because there's not a lot known about CKD. Excuse me. CKD is not curable. It is not an irreversible disease at this moment. How many stages are there to chronic kidney disease? So the options we have are 3 stages, 7, 2, and 5. With CKD, there are 5 stages ranging from minimal, mild, moderate, and severe to finally kidney failure or end-stage renal disease. So that is 5. What is thought to be the cause of CKD? Our options are diabetes, heart failure, the cause is unknown, and an unhealthy diet. Again, from the presentation, we would know that there is currently no cause that is known for chronic kidney disease. So we are going to put the cause as unknown. True or false? Electrolyte imbalances are a common complication of chronic kidney disease. So when you think of this question, maybe go back to the labs and see what are we looking for with those labs. We're assessing urinalysis, BUN, CBC, and then the blood electrolytes, which is the decreased sodium and calcium, and then increased potassium, phosphorus, and magnesium. So that is true. We are looking for electrolyte imbalances. And finally, what is the main lab result that determines what stage of CKD the patient is in? So again, what we're looking at those different stages. What is the main factor we're assessing with these patients to determine what stage of chronic kidney disease they are in? We have glucose, the glomerular filtration rate, which is the GFR, it's a lot easier to say, urine culture, and magnesium level. So these you can break down because we do check for a magnesium level because that deals with the electrolytes, but what we are using to analyze what stage they are in of chronic kidney disease is the GFR. All right, and we passed our test, so you paid attention. So the link is on here. If you want to go through and quiz yourself, you are more than welcome to. And that is all I have for my presentation. Thank you for participating today. Any questions, comments, or concerns, feel free to let me know. Thank you.